This is the human hand and forearm. My name is Cindy. So bones and parts that make up the arm include the humerus, the ulna, the radius, the carpals, the metacarpals, and your phalanges. Some interesting trivia and facts. Fingers are never perfectly straight. Usually the index, ring, and small finger curve sideways. And there's that saying where if you crack your knuckles, it's bad for you, or it gives you arthritis. Well, that's actually false. It's the popping or bursting of the CO2 bubbles in the joints that cause that cracking noise. And a historic reference you can tell someone is that during the Gallic Wars, Julius Caesar ordered the thumbs of captured warriors amputated so that when they returned to their country, they would serve as examples and be unable to bear arms again. Anterior muscles that make up the forearm include the pronator quadratus, the pronator teres, the supinator, the interossei palmaris and dorsalis, flexor digitorum profundus, flexor pollis longus, flexor carpi ulnaris, flexor digitorum superficialis, as well as flexor carpi radialis and palmaris longus. Taking a closer look at the pronator quadratus, its origin is in the ventral surface of the distal 1/5 of the ulna. Its insertion is in the ventral surface 1/5 of the radius, and its action is to pronate the forearm. The flexor pollis longus, its origin is at the anterior surface of the radius and adjacent to the interosseous membrane. It inserts at the ventral base of the distal phalanx of the thumb, and its action is to flex the thumb. The pronator teres, its origin is at the medial epicondyle of the humerus and the coronate process of the ulna. It inserts in the midshaft of the lateral margin of the radius, and its action is to pronate the forearm and a weak flexor of the elbow. The flexor carpi ulnaris, its origin is at the medial epicondyle of the humerus and the posterior surface of the ulna. It inserts in the base of the 5th metacarpal. Its action is a powerful flexor of the wrist, and it adducts the hand. So what is carpal tunnel? Carpal tunnel is a numbness and tingling in this blue area, which is caused by the pressure on the median nerve. Posterior muscles that make up the forearm include the extensor digitorum, which its origin is in the lateral epicondyle of the humerus, and it's inserted by 4 tendons into distal phalanges of 2nd through 5th digits. Its action is the prime extender of fingers, and it assists in extending the wrist. The brachioradialis, its origin is in the lateral ridge at distal end of humerus, and its insertion is in the styloid process at lateral distal end of the radius. Its action is to flex the elbow, and it assists in both pronation and supination. The extensor pollis longus, its origin is at the dorsal shaft of the radius and ulna. It's inserted in the base of the distal phalanx of the thumb, and its action is to extend the thumb. The extensor indicus, its origin is in the dorsal ulna and its adjacent interosseous membrane. Its insertion is in the base of the distal phalanx of the 2nd digit and its dorsal head. Its action is to extend all joints of the 2nd finger. What is chronic elbow pain? Chronic elbow pain is the inflammation of one or both of the elbow's 2 tendons. Chronic elbow pain can then be categorized into different motions that cause a different kind of pain. There's tennis elbow, which is irritation of the tissue connecting the forearm muscle to the elbow, and golfer's elbow, which is a condition that causes pain on the inner side of the elbow. That's the end of my presentation. Thank you for watching.